Hello and welcome back to my video show. The last video we talked about craniosacral for pediatrics. I want to just make a demo on how I treat babies because a lot of parents have the question, what does the session look like? What are we going to do? So obviously for HIPAA reasons and privacy reasons, I can't use a real baby, but I'm going to show you on this kind of like newborn sized doll how I treat, what it looks like. It's always going to be a combination of various manual osteopathic techniques, so it's not just craniosacral therapy. And again, I'm going to mention what I'm doing. So you come in with your baby. If the baby is calm, quiet, we're going to put it on a blanket, comfortable on the table. The baby is crying, you console it. I console it, and it's going to be very gentle touch. How I usually start, I start at the lower back. So I'm gonna check for any misalignment in the spine. I mean, the doll has a little bit of a rotation, so I check for torticollis. Are the shoulders even? What's going on with the hips? And then I just gently place my hands under the lower back, and I'm gonna release the fascia all along the spine. Do a little bit of neuromanipulation on the spine. Mobilize the legs. Boom. Usually baby releases pretty fast. Turn the baby gently around and then place the head in my hands. And I'm gonna do some more neuromanipulation, which means the baby's head rests in my hands. And I gently traction the spine and release the vertebrae. So kind of like how when you go to the chiropractor. Now I don't want to talk about chiropractic pediatrics because I don't know how they treat it, so I can only speak for myself how I treat. So again, very gentle, and I'm just going to release the spinal cord. C1, blip each vertebrae, go down and find the restriction. Then I will check what the cranium looks like. I might do some cranial molding, or it just depends on what's going on. I will start to do some visceral manipulation on the abdomen, especially in the newborns, because the whole cycle has to change while they're in utero. They're connected to mom's blood flow, digestion, and everything. So when they're born, the first 2 weeks, the blood flow changes the direction. The liver has a lot to do, and then they have to. It's a lot, like not just going through birth, but also being on planet Earth. So now gravity kicks in. You have to lay. You have restrictions. However, the baby was positioned in utero. Then the digestive tract, you have to start eating. It might not be so good with some of the things the mother is eating with the breastfeeding. So I'm going to treat the abdomen, I'm going to treat the liver. I will also put on a glove if I can already see. I mean, I've been doing this for such a long time. I already see if a baby has a very tight midline, frenulum, lip tie, tongue tie. Put on a glove, very gently. Usually use my pinky finger in the really little babies. The tiny ones, put my finger in the mouth, and I'm just gonna check how they are suckling, and everything is always very gentle. You have to think of it like yoga, where you go with the flow, compared to PT, where you're moving something. So everything is gonna be like very gentle. And I'm gonna check how's the suckle. I'm gonna run my finger gently along the gum line, behind the lips, or check for lip tie. In newborns, it's very not difficult, but sometimes it gets overlooked because the frenulum, it's there, but it doesn't look as tight as it might look later on. But people who have experience, which I consider myself years of working in the field, I can see if there's a lip tie. I will check also for a tongue tie, run my finger along the tongue, mobilize the side of the tongue, mobilize the cranial nerves, everything very gentle, and the baby is always in charge of the session. So I will never force the baby to do anything. The baby starts crying. Often even though the mother has already fed them, they get like hungry. The treatment usually feels good. They get hungry, or they just have bowel movement. So I will have the mom put the baby on the breast if she's breastfeeding, or if there are breastfeeding issues, we're gonna put the baby on the breast. I'm gonna see where are the issues, and I'm gonna treat from there. Release the fascia again, everything super gentle. mobilizing, showing some exercises to the parents, and that's about it. So no worry, nothing's going to happen to your baby if you bring it in. I think everybody who's being born could benefit just from that one session of having the fascia release, some of the restrictions from in utero, going through birth, even C-section, molding the cranium. Yeah, I hope you enjoyed this short demo of treating a baby. Thank you.